Okay, ladies and gentlemen, welcome back to psychology. Here we are for lesson 7. This week we're going to be talking about therapy and helping to change people back towards mental stability as opposed to mental illness. And this is really going to build on last week's lesson, or last time's lesson, that talked about psychiatric disabilities and diseases. And so what do we do when we have somebody who is struggling with a psychiatric disease? How do we help them get back to some level of normalcy? That really is going to be the focus of this time's lesson. So for our spotlight, we're going to talk a little bit about how we used to treat people. The lesson today is really going to talk about how do we treat people now with mental illness. This is talking about historical treatment options that people used. And options is used pretty loosely here because these weren't very good options. Here on the right you can see a picture of men who in the early part of last century, the 1900s, were in an insane asylum. You can see that they're in straitjackets. You can see that they're just kind of housed. It doesn't appear that they're receiving any kind of treatment. And that was really what we did with people with mental illness. They scared us. We didn't know what to do about them, and so we kind of shut them away. Early on, we thought that mental illness was connected with demonic possession. This is very early on. So back in the Middle Ages, Dark Ages, when someone was suffering from a mental illness, they were thought to be somehow a puppet of the devil, and oftentimes were killed because of that. It scared people. They thought maybe they were witches or, like I said, possessed by the devil. And so they were certainly to be avoided, and oftentimes they were killed to just get them out of society. Thankfully, we progressed from there, but still, we didn't really know what to do with people with mental illness. Back in the 1800s, pretty much we just shut them away. We put them in asylums, insane asylums, and they had very little contact with other people and not much in the way of a treatment option. They were essentially thought to be, it's kind of like a jail. We can take the people that are not normal, we can shut them away, and at least that way they won't be hurting the regular society. That was kind of the way that we dealt with them up until more recent times. Treatment options included, back in these times, exorcism. This was back when there was thought to be a connection with demonic possession. If the devil was inside of you, then what you need to do is exorcise that devil away, and a priest would be brought in to do that, and an exorcism would be brought. Then we moved on to assuming that there was something wrong with the brain, which was a good connection between mental illness and the brain, but the solution was pretty archaic, and that was something called skull coring. And the idea was that if you took a piece of the skull out to allow these evil spirits to escape, that you would support the health of the patient. And of course, shockingly, most of these patients died with the medical technology at that point. They didn't know how to deal with that, and disease set in, and people would die. More recently, some of the treatment options that are a little bit over the top are electroshock therapy, and we're going to talk about that at the end of this lesson, so you get more information about that. But you can see these were pretty brutal type of treatments, and we're definitely not focused on helping the person achieve some sort of mental stability. It was really just some ways to kind of either shut them away or a really lack of understanding of what was leading to some of these problems. So we possessed, and so let's take a look and see what we do now with folks that are suffering from mental illness. Well, we do something called psychotherapy. Psycho, obviously, is like psychology, is dealing with the mental capacity of a person, and therapy is to try to support, to help. A therapeutic approach is an approach that tries to help someone become more normal and treat the mental illness. So that's what psychotherapy means. Psychotherapy involves 3 critical elements for something to be useful and working towards helping a patient recover from a mental illness. There has to be an interaction between the patient and the therapist. There has to be a relationship that is developed, that is trusting, so that the patient and the therapist can work together to try to achieve some sort of normalcy. So psychology is a verbal science as much as it is anything else. We're going to talk about antipsychotic drugs and things like that later in this lesson, but for the most part, most therapies involve talking things through, developing relationships, helping to set up new processes that will allow someone to cope with the problems they're dealing with. That's really the basis of psychotherapy. And then, of course, the therapist has to analyze what the patient's problem is through this relationship, trying to figure out what is the issue and developing a course of treatment to help that person. There are a number of different types of psychotherapies. We're going to go into detail of all of these in just a minute, but just to give you a quick overview, and the graphic over here, the pie chart, I guess, on the right-hand side, gives you an idea of the amount of use of each of these types of psychotherapies. So you can kind of see what is most popular at this point in time in terms of trying to help people with mental illness. But all of them are used to some extent or in combination. The first is psychoanalysis. Psychoanalysis is based on the work of Freud, and we'll get into that in a minute. This is free association, dream analysis, the unconscious mind as a window into what's causing the problem for the person. Humanistic approach to psychotherapy is more what you would think of kind of on the couch. When you think of a psychiatric therapy session, probably from a movie, it's somebody sitting down on a couch and a therapist sitting in a chair and saying, describe your feelings, what's going on, things like that. That really is kind of the humanistic approach. It's developing that solid relationship, active listening on the part of the therapist, heavy-duty support, trying to develop that strong relationship. Cognitive psychotherapy. Cognitive, remember, dealing with the mental process, and that's a very rational therapy where we're trying to get at the root, thinking things through. Really heavy-duty cognition in terms of trying to understand what the problem is and work through it. Very linear, very intellectual. Behavioral is another type of psychotherapy, and that's really what we're doing with conditioning. That's identifying what the behavior is that is causing people, or the patient, a problem, and then coming up with strategies to avoid that behavior and come up with better behaviors. And then there's what's called the eclectic type of psychotherapy, and all that means is really it's a combination of most of these, or many of these. And that's the red piece on the bottom of the pie chart, and you can see that that's what most therapists use, is a combination of a number of these different things, depending on the patient's issues, the patient's problems, and what seems to work best for them. Another way that we can help people get better and develop some strategies for dealing with their mental illness is through group therapy. Group therapy is very popular and has been made more so in recent years. And that's the idea that we have a therapy session with multiple people who are suffering from the same issue. This was really based on the concept of several big self-help therapy groups like Alcoholics Anonymous, things of that sort, that really deal with kind of developing a common cause with other people. Here's other people that are suffering from the same problem, and I can learn from them and support them. The benefits of this are that you recognize as a person suffering from a mental illness that you're not alone, and that is really a huge piece. Many people suffering from illness think that it's just them and there's something wrong with them. When they are in a room with other people who are suffering from the same type of thing, whatever it is, that helps them understand this is something that other people are going through. They can also watch other people in their group recovering. People will be in different stages of recovery, and so somebody might be getting quite well, and so that there is some hope that's generated by knowing that I will get well too. And then finally, when people are working towards recovery, they can support others that are not in good a shape, and that can definitely help them become better and more healthy as well. So one of the groups of therapy sessions is family therapy, and that's really popular. If the family has become dysfunctional, if there's a problem with one or multiple members of family, oftentimes a family unit will go in and work with a therapist to try to figure out what's going on. So let's go through each one of those types of therapies a little more in detail. And you're going to see some connections with things that we've done in the past. And here we'll start off with psychoanalysis. And our buddy over here on the right-hand side, good old Sigmund Freud. You just can't go anywhere in psychology without dealing with Sigmund. There he is, looking cool, smoking a cigar. And he is really the father of psychoanalysis. Psychoanalysis is the idea, if you recall, that everything that happens is connected with the unconscious mind. So it's all in there. It's just we can't get it out without some real probing and prompting. And the way those are done are two main pieces. One is through what's called free association. And free association is the therapy session where the therapist will ask a patient to just say whatever comes to mind. So just start talking. Just talk, and without any subject, without any prompting, just start talking. And then once the patient has spoken, the therapist will help to examine maybe what's been said. And this is the idea that it gives us a little bit of an idea of what's going on unconsciously, because it's just off the top of your head, if you want to think of it that way. Another way, similar kind of desire, but a little bit different, is the concept of dream analysis. So a therapist will ask a patient to remember everything they can, write down everything they can from a dream, and then interpret those dreams with what's going on in the waking life. So a scene of, and we've done this, if you recall, in one of our case studies, when you're falling, that has some meaning, and when you are running but you can't get away from a pursuer, that has a specific meaning, and things of that sort. So that would be dream analysis. Those are important parts of psychoanalysis. The humanistic theory, or therapy I should say, was based on the work of Carl Rogers, and we've talked about him before. Humanistic ideas are essentially, what can we do to help people fulfill their potential? Everybody has this human potential. We have to build on the triangle, if you remember of this, of Maslow's theory of needs. So we have to give them their basic needs, food, water, air, those type of things, and then we build our way up, and part of that is we have to give them mental health, and so this is the place where we're trying to build on that. It is a very, if you want to think about it, kind of a soft touch way to do business. This is building relationships, developing a feeling of responsibility in the patient, giving them freedom of choice. And this is really the idea that every human being has this unlimited potential. They just need to realize it, and some people need more help than others. And so a therapist's job here is to essentially provide unconditional positive reward. There's never going to be negativity. It's always going to be positive. It's building a person up, making them feel more confident, and then they can go out and fight whatever issue they're dealing with from a mental standpoint. Cognitive theory, or therapy, is more dealing with the idea that thoughts are the issue, and thoughts can control our emotions and behaviors. And so what we have to do is, if we have the negative thoughts that are pervading our world, we need to get those out of there, and we need to replace them by positive thoughts. It's the power of positive thinking, you can think here, is what we're going on. A subgroup of cognitive therapy is called rational emotive therapy, and that really is talking about helping people move from unrealistic assumptions and ideas to more realistic ones. So if we're always saying, I'm not smart, or I'm not capable, or I'm not good, or I'm not pretty, or whatever it is, that we're always these negative things that are just rolling through our brain, we've got to get those out of there, because those are self-fulfilling prophecies, that if you think that, you will act that, and that's who you will become. So cognitive therapy is really dealing with changing the thought patterns of our life. Behavioral therapy, remember this one? This is a good one. Here's the picture, we've seen this one before, of this dog and a bone and a bell and all that good stuff. Pavlov's dog, B.F. Skinner and his mouse in a box trying to get cheese. These are all things that are learning behaviors. So we're not worried so much about, like with Freud, the deep, dark unconscious. We're just saying this person, the patient, is exhibiting a behavior that is negative. So what we're going to do is we're going to help them unlearn that behavior and learn a more appropriate behavior. And we're going to do that through conditioning. And the very simple way of the conditioning, just to remind you with Pavlov's experience with the dog, is, you show the dog the bone or a piece of meat or whatever you want to think about, and the dog is excited and starts to salivate. And you take that away and show them the bell, ring a bell. Well, the dog doesn't have any connection with the bell. But if you ring the bell while you give them the bone, then they're going to develop over time, be conditioned for when the bell rings, they start to salivate. That's kind of the concept. So, obviously we're not dogs, but that's the very simple, basic idea of how we're going to recondition people to think more positively. So let's unlearn the negative behaviors. Let's reinforce the positive behaviors. And another piece of that through conditioning that we can do is called aversive conditioning, and that's we're going to make the negative acts unpleasant. So we're going to give a negative consequence for every time the person does something that is counterproductive or negative to them. So, a good example would be that you would receive a quick shock, or that you would, that somebody would do something to you if you are exhibiting this negative thing that you don't like. And then so you will learn very quickly, well, I don't like that, so I'm going to stop doing that behavior. That's kind of the concept behind behavioral therapy. Before we go on to this particular slide, just to give you an idea, again, with the eclectic therapy that we talked about, that's where we cannot combine multiples of those ideas. And that really is how most therapists work. Is most therapists are trained in all these areas. They have therapies that they believe in more than others, but they essentially will combine them together for individual people. Now, if the more verbal discussion, relationship type therapy is not effective, one thing that can be used either in addition to or instead of is drug therapies, using prescription medication to try to support people with mental illness. And of course, this is not solving the problem, this is just dampening the problem with the drug. But for some mental illnesses, this is required, that you cannot get anywhere by just trying to talk it out. These things have to be helped by medication. So there are really 4 types of drug therapies that are used by therapists. The first is antipsychotic drugs. These are drugs that reduce agitation, delusion, hallucinations, those type of things. So somebody that's suffering from, for example, schizophrenia would probably be on an antipsychotic drug. They would need that to try to kind of even out their system. Okay. A second one would be antidepressant drugs. Well, that's pretty easy. If you're depressed, and if you continually are in this cycle where you just can't move, you can't get up, you can't do your work, you can't interact with people, there are medicines that can help you with that. Lithium is a medication that was used a lot and still is used to some extent, although it was overprescribed back in the 60s and 70s. But now it's being used to manage people with bipolar issues. And if you remember bipolar, that's the idea of manic depressive. So high highs where you're elated to low lows where you're depressed. So the bipolar, people that are suffering from bipolar episodes, lithium can be used to kind of dampen that out so you don't have those peaks and valleys in terms of your behavior. And then anti-anxiety drugs are used to reduce that excitability, calm a patient down, settle a patient down that's anxious about things. So again, those are used oftentimes either in conjunction with a verbal therapy that we talked about before, or maybe just completely on the drugs by themselves. Finally, I want to talk about, and this is not used as much as it used to be, but it's again one of those pictures that we think of when we talk about psychiatry, and especially in a psychiatric institution, the idea of electroshock therapy. There's a picture here, and the reason I put this in is from a movie that it's a comedy movie. It's kind of a dark comedy movie from the 1970s, early 1970s, called One Flew Over the Cuckoo's Nest. And this was based on a book by a writer named Ken Kesey. And the reason I add this is because it really gives a great image of what life in a psychiatric institution looked like. And it follows one particular patient who is in the psychiatric institution and what it looks like to interact with people, what a psychotherapy session might look like. And one other piece that is shown in this movie, and is a pretty powerful scene, is where this patient receives electroshock therapy. And in electroshock therapy, what happens is that the patient is administered a brief electrical shock to the brain, and this happens multiple times over time. And the desire, what we found this is useful for, is to treat severe depression. For whatever reason, that electrical impulse that's being placed into the brain supports that particular issue. And this is very, very controversial, this particular therapy, and it's not used very much right now. It was used a lot in the past. It's thought to be very barbaric by many, and the reason is because the visual is so over the top. The person is unaware because essentially he goes unconscious, so he's not in pain, but the person receiving the therapy, the electroshock therapy, will convulse, will appear to have seizures. It's a very ugly therapy, but it's thought by many doctors to be effective. So it is used to some extent, although very limited these days. And there are some pretty heavy-duty negatives about it too. Not only does it appear to be barbaric, but it also, there are some memory loss issues that can occur over time. So you have to be very careful about this therapy. But if you have an interest in just kind of what does it look like to be in an insane asylum, I would recommend, talk to your parents because it's an R movie, but it's called One Flew Over the Cuckoo's Nest. It's an amazing movie. It was an Academy Award winner back in the early 70s. All right, so that's a little bit about therapy, change, how we can support people with mental illness, and we'll be talking more about some of those dynamics in the lessons to come.